Ons fiksheidsafrigters staan gereed met raad oor hoe om gemotiveerd te bly gedurende die koue wintermaande. Maar eers loer ons in by ons vriende van Lamelle vir velsorg inspirasie.
Cynthia, it's very, very nice to meet you, our lady in red. Before we get into the skincare options and treatments, why don't you tell us a little bit more about yourself and what your skin concern is?
Ek hou van extreme sport, bungee jumping en sulke goed. Alhoewel ek uitgaan in die son, probeer ek gedurig my vel beskerm en ek stel nie my gesig juis bloot aan die son nie. Ek sit maar altyd 'n hoedjie op en ja, ek sukkel 'n bietjie om sekere ouderdomsmerke weg te kry, bietjie pigmentasie. So ek sal graag bietjie met u wil gesels oor wat is my pad vorentoe met my vel.
Well, that in itself is not too difficult. We can cover those. But before we do, you clearly have not only a very active lifestyle, but it sounds as though you've taken really good care of your skin. In terms of professional treatments that you might have done in the past, have you done any? And if so, what did you have done for your skin?
Ek gaan gereeld vir peeling. En ek het op 'n stadium, ek weet nie wat presies noem mense dit nie, maar dit is waar hulle so naal deur jou hele gesig trek en dit lyk soos 'n kollageen of iets drade wat hulle insit. Maar nou raak ek bietjie ouer en ek sien al hoe meer die ouderdoms trekke om my mond, om my oë, pigmentasie en bietjie sakke onder die oë wat ek ook graag sal wil ontslaaf van raak.
Now, let's take your scenario. You've told me that you take very good care of your skin, and I like the fact that you've continued with exfoliation, because as we're aging, our skin slows down with shedding. And what you're doing now with your exfoliation is you're keeping that skin stimulated and turning over, which will be the best thing you can do. Treating the pigmentation and the aging spots that you speak of, that is really through choosing the ingredients that can help reduce pigmentation. But this is a very important point, is that sometimes the dark pigmentation spots that occur underneath the eye, a lot of people think that those are pigmentation marks, and they're not really. In many instances, these are actually growths on the surface of the skin. Now, they're very flat, they don't stick very high up, but it's not actually pigment, but excess skin growth over that area. Those little lesions sometimes have to be removed by burning them off. So very, very common around the eye area. You'll find that patients with a slightly darker complexion, as they're getting older, this manifests a lot. And so trying to treat those, they don't come off with peels. You'd need a very aggressive peel just on the actual lesions, but most likely freezing them off. That takes some preparation and care, but that might be a better alternative for you, as opposed to trying to just use a cream for that. So using the idea of using threads, a little bit of filler, plus a little bit of burning off, really does point to the fact that sometimes home care alone isn't going to give you the result you're looking for. And you've mentioned specifically the sagging and the fact that you feel your eyes are closed a little bit. And that is really due to this loss of volume in the voorkop, and the threads volume can help lift that. I have to be honest and tell you that a topical cream, a topical solution is not going to lift that. I wish it did, but if we look at what's caused the problem in the first place, a topical rumpie of sulfur is not going to fix that. And we're going to have to look at something a little bit more invasive, and that's something you cannot do at home. It's not the skin, it's what's underneath the skin that's also changed with age. Does that mean you should give up? No, don't give up. Your program sounds magnificent, and your skin shows a nice even color, and it's wonderful. It's just about your specific concern for the sagging. I'm saying to you, you may need to consider these non-surgical alternatives at the very least if you want a good result, or a more surgical procedure if you want more of a final result. So your skincare program is fantastic. I really, really admire your commitment to your program, and that's fantastic, and it shows. Recognize that what you're most concerned about is not because of poor skin. Although trying to make your skin as healthier as possible and rebuilt as well as we can will certainly make some improvement. But what you fundamentally have a problem with is something that's occurring much deeper underneath the skin. And for that, we have to be reasonable and say, look, we might need these other procedures to move forward. So I hope that's given you better insight into what's happened. I don't know if you have any other questions for me.
Nee, ek verstaan.
Good, okay.
Ek sal net graag wil weet wat is nou my pad vorentoe.
Of course. And I think finding the right type of topical to give you the best possible outcome for your skin is absolutely the critical thing to do. But I think we need to just make sure that the expectation of what a topical cream can do is very clearly explained, that you're not left disappointed at the end of that treatment program. Cynthia, thank you very, very much.
Baie dankie Dr. Bradley, dit was goed om u ook te ontmoet.